So the NHLBI-MDS Natural History Study is really this marvelous project that we've undertaken to really try to understand myelodysplastic syndromes in the United States. And nobody has ever done this before. It's a prospective study where we're enrolling patients when they're suspected of having myelodysplastic syndrome. So even before the diagnosis has been confirmed, to really take them from the first time point moving forward and look at clinical characteristics, at their bone marrow biopsies, and we actually have these bone marrow biopsies electronically scanned into a database so anyone can have access to them, collect over time information on quality of life, and continue to collect tissue samples to build a biorepository that I think will really be an amazing resource for people over the next decade. In this study, we looked at the discrete period of time during the COVID pandemic to see how patients with myelodysplastic syndromes actually did. What we found is consistent with other studies, and that is that patients who have myeloid malignancies who contract COVID-19 do tend to have worse outcomes than the general population. They're more likely to be admitted to intensive care units and more likely to die. But in the future, I think what we're going to also do is collect information on vaccines. And what a number of studies are now showing is that patients who do get vaccinated who have myeloid malignancies actually are able to generate antibodies. And there's a provocative study here at ASH this year as well out of Moffitt that shows that there's over 90% ability to acquire antibodies when patients are vaccinated. So it's again a call to arms for those of us in the myeloid community to make sure that our patients get vaccinated, and secondly, to make sure that they continue to practice precautions against acquiring COVID-19, because if they get it, their outcomes are much worse than the general population.